Hello? Hey, kiddo. No, I'm just getting done with sim class. What do you need? Yeah, that should be fine. Let me just go ahead and call Dad and ask if that's fine. Oh, a group of your friends? Oh, sure, yeah. Yeah, Cheyenne and I just got done with a project for our farm class for epinephrine. You guys can come over and see what we gathered up for the information. All right, we'll see you later. All right, love you, bye. Hey, honey, I just wanted to give you a call and see how everything was going. Yeah, I just got home and I changed. I just wanted to run something by you real quick. Well, Kasha had an assembly at school today about epinephrine, and now they have to write a paper over it. Is it okay if they come over and review my information that I have? Yeah, it should be about 4 of her friends. Yeah, I think I'm gonna make peanut butter cookies for a snack for them. Okay. Love you. Have a good day. See ya.
While researching, the girls found out that according to the Mayo Clinic, epinephrine can be used for severe allergic allergies, anaphylaxis, from insect stings or bites, food, and medicines. This medication can be used to treat septic shock as well as hypotension in adults. Anaphylaxis and septic shock are life-threatening. Upon researching, one of the girls found out that one of the most critical steps is to administer medicinal epinephrine immediately for anaphylaxis. According to her resource, Mayo Clinic, the trade name was epinephrine and the brand names that are used are Adrenaclick, Adrenaline, Adrenaline Chloride, Auvi-Q, EpiPen, EpiPen Jr., Simjepi, and Twinject. This is in the pharmacological class of alpha and beta adrenergic agonist per Focus on Nursing Pharmacology book. The next question that all the girls had was how epinephrine works in the body as a vasopressor and a hormone, also how fast does it work. The results of administering epinephrine through injection or through a vein are almost immediate and should show improvement in 5 to 10 minutes and were often 20 to 30 minutes, per allergyasthmanetwork.org. Research has shown that epinephrine acts on the body in a few ways. According to allergyasthmanetwork.org, it relaxes the muscles in the airways, making it easier to breathe. Epinephrine also helps constrict blood vessels, reducing swelling and itching as well as maintaining blood pressure. Lastly, epinephrine can stimulate the heart, ensuring adequate blood flow to vital organs. So, the next step to figure out is how epinephrine is administered. The girls found out that it could be used under the skin or into the muscle to treat anaphylaxis, and if it is treating septic shock, it may be injected into a vein by a doctor or nurse in a medical facility according to Medline Plus. As a group, they all found out epinephrine is most commonly administered through an autoinjector, called an epipen. It's a simple device that contains a pre-measured dose of epinephrine of 0.15 milligrams for the junior group, which is considered to cover 33 to 66 pounds. The other option of the epipen is 0.3 milligrams for 66 pounds or more. According to the website listed on the box, www.epipen.com. It can be administered through clothing. If necessary, the needle automatically retracts after the injection. After that is completed, Medline Plus recommends taking the used device to the emergency room with you or taking it to a pharmacy, hospital, or any healthcare provider and ask them to dispose of it properly. The cost for auto-injector brand names ranges about $690 and the generic version, called epinephrine auto-injector, costs approximately $345 without insurance. The next question from one of the girls in the group was, what if someone doesn't have an auto-injector? So, they decided to research that answer next. One of the girls found in a resource that if an auto-injector is not available, you use a vial and a syringe with a needle attached for an intramuscular injection in the outer thigh. This is usually during the ambulance ride to the hospital according to National Library of Medicine. It's crucial to seek medical assistance immediately afterward, as epinephrine is not a substitute for professional medical care, even if the person starts to feel better. While in the hospital, the nurse should consider the patient's medical history for any diagnosis that may interfere with epinephrine or allergies that may be an indicator for that severe allergic reaction. Physical assessment is another tool that is vital to consider vital signs, weight, blood labs, urine analysis for medication adjustments, as well as other indications. It's also essential to keep an eye on the individual, as symptoms can recur even after the initial treatment. The girls were thankful for the vital information that was researched by Cheyenne and myself, as well as other resources that were available while they researched. All the girls felt knowledgeable as to how they can help someone experiencing a severe allergic reaction. The girls also know that they will each have to be educated on how to administer epinephrine for an allergic reaction. In most cases, it's strongly encouraged to wear a medical alert identification to identify that person's severe allergies. It's always better to be safe than sorry. Some adverse reactions may include but not limited to anxiety, pain in the arm, back or jaw, angina, confusion, speaking difficulties, fast and irregular heartbeat, nausea/vomiting/diarrhea, sweating, shakiness in extremities and facial muscles, pounding in ears, trouble breathing according to Mayo Clinic and Medline Plus. Video How to with Steps.
1, 2, 3. Remove blue safety release by pulling straight out without bending twisting. Step 2. Swing and push firmly the orange tip against the outer thigh so it clicks for 3 seconds. 1, 2, 3. And hold on the thigh approximately 3 seconds. Step 3. Tip extends after use to put the needle back in. There you go.